is Rithin Nedumannil. I'm a consultant haematologist, both in clinical haematology and laboratory haematology, and I work at a number of different institutions across Melbourne, Victoria, including Peter MacCallum Cancer Centre, Austin Hospital, and Eastern Health. I've had the opportunity to pursue all of my medical training across Melbourne, Victoria. My medical school upbringing was actually in Adelaide, South Australia. Thereafter, I moved here, started my internship at Austin Health, did my basic physician training at Northern Health and Austin Health, and then thereafter transitioned to haematology advanced training across a number of different sites, including Austin Health, Peter MacCallum Cancer Centre, and Royal Melbourne Hospital. Thereafter, I transitioned to doing a 2-year fellowship in acute leukemia and myelodysplastic syndromes, and had the opportunity to work in a clinical trial setting where I had the opportunity to conduct and also be a sub-investigator, an associate investigator in a number of phase 1, 2, and 3 clinical trials, exploring a number of novel therapies in these blood cancer conditions. Based on the retrospective clinical information that I've acquired during my clinical fellowship in acute leukemia and looking after patients being treated with menin inhibitor therapies, I decided to undertake a PhD in exploring and investigating the mechanisms of resistance to menin inhibitor therapy in acute myeloid leukemia. And I'll be undertaking this PhD initially through the Cambridge Stem Cell Institute at Cambridge University in the UK for a period of 2 years, where I'll be able to access a number of genetic and epigenetic technologies to investigate these mechanisms of resistance. And thereafter, I'll transition the remainder of my PhD back to Sir Peter MacCallum Department of Oncology at the Peter MacCallum Cancer Centre in Melbourne, Victoria, where I previously worked before. My PhD wouldn't have been able to be conceived or conducted without the assistance from a scholarship being provided by both the HSANZ, which is the Haematology Society of Australia and New Zealand, as well as the Leukemia Foundation. I am looking forward to being able to proceed with my PhD as a result of the fortunate funding from these two institutions, and look forward to updating the audience with the results of this research going forward. I think discovery, as you've mentioned, is definitely one particular area that really gets me going in the clinical practice. Looking after the patients and being able to personally deal with them, not only from their medical perspective, but also holistically providing them with care and compassion during the tough times that they're experiencing as a result of the blood cancer diagnosis, also really motivates me to try and improve the outcomes for these patients. I also really enjoy collaborating with clinicians and researchers worldwide and locally, and trying to get new insights into these blood cancers and ways that we can try and combat and hopefully achieve better remissions and even the concept of a cure for these patients going forward. Beyond reading articles on menin inhibitor therapy and acute myeloid leukemia in general, my other interests are particularly in badminton as well as playing the piano. I also like reading and just spending time with my family and friends as well.